This is me, Dr. Akshata. I am working as a consultant in the Department of Hematology in Majumdar Shah Medical Center. We'll be speaking on the topic of blood cancers, and on this occasion of World Cancer Day, closing the care gap in the treatment of blood cancers. So with us we have Dr. Sharath Damodar. He is the head of the Department of Adult Hemato-Oncology and BMT and the clinical lead at Majumdar Shah Medical Center, Narayana Health City, to speak with us his views on blood cancers. Hello, sir.
Hi.
We would want your opinions on blood cancer. So I'll be asking you certain questions. So what is blood cancer actually?
Yeah, so thank you, Akshita. So on this occasion of World Cancer Day, we thought it's relevant to discuss on the topic of blood cancer. And like the first question which has come across, everybody has this fear of the word blood cancer, and it's usually associated with almost like a death sentence. This was what was the scenario about 20 years ago, but we've moved significantly from there. And in today's day and age, even when there's a diagnosis of blood cancer, it's not such a fearful thing. There are treatment options available. So essentially, to start off with the types of blood cancer, typically it's called acute leukemia. That's the term which is used. And there are two types, myeloid and lymphoid, and that can be different in various age groups. So in children, when they have the acute lymphoid leukemias, the cure rates are pretty high with just chemotherapy alone, which is a very good thing. It can be close to as high as 80-90% in some of the Western data. And in our own country, we've got data to suggest about 60 to 70% cure rates in acute lymphatic leukemia in children. However, in adults, the outcomes are not so good. It's closer to the 50% range. But still, we know that there's a population of about 40-50% who can still be cured with only chemotherapy. Some of them may subsequently require a bone marrow transplant, which is the next kind of treatment. So that's the reason why it's important to find out the type of the blood cancer when it's diagnosed. The myeloid leukemias are a little more difficult and more aggressive to treat, and so the treatment regimens are a little different. But we have treatments which we can cure even that subset of patients. So when somebody is told that they have blood cancer, it becomes important to differentiate the types so that we make a correct treatment plan. And like in any cancer, the earlier you get to treatment, obviously the chances of you getting a response and cure are higher. So that's why we always recommend that don't delay in your diagnosis. Quickly get the diagnosis sorted out and get the treatment done. Another type which is commonly also seen in the older people is a disease called myeloma, which is also sometimes called as bone cancer or a type of blood cancer. There again, it's a cancer of the plasma cells. And there you get bone lesions. So a lot of people, older people, when they come with either a fracture, back pain, bone pain, is when we get evaluation done. So there again, the dictum is that early diagnosis will always help to get better outcomes. So that's why we always insist that if there is some issue which crops up, please get that addressed immediately so that we can figure out the problem quickly. So that's a little, overview of what is the types of the blood cancers in adults.
That was a nice overview on blood cancer, sir. So what are the symptoms should people look out for in blood cancer, and whom should they go to first, or should they come directly to a hematologist or a hemato-oncologist? So what are we looking at? What should people look out for?
Right. Yeah, that's a very nice question, Akshita. So essentially, whenever we're talking about cancers, we tell people do a checkup, annual checkup, and try and see, get some blood test done, a scan, X-ray. So these are general things which are recommended. But just because you had a checkup done, say a month back, it's not that you cannot get a cancerous disease a month down the line. So, and you cannot go on testing people every month for some of these problems. So one way, people would have said is, why don't you go on doing blood tests, but there's no end to it. So it should be done when there is a problem. And what are the problems which can come up? So just like for any cancer in general, we always worry when somebody has persistent fever, weight loss, or they notice some swellings in the body, or some pain which is just persisting. It can be abdominal pain, chest pain, bone pain, which is just going on for weeks together. Please don't ignore that. It should be addressed. And the best way is to go to a general physician first, let him see what the problem is, and based on that, ask for some tests. Most commonly in today's day and world, everybody gets blood tests easily done. So that's commonly done. So one easy way to do is just get routine blood tests done. Sometimes we may need imaging like an ultrasound, chest X-ray, if you're suspecting some mass or swelling or a bone lesion. So once these blood tests are done, then a lot of the blood cancers at least will get picked up on that. And typically it will manifest either as anemia, which is low hemoglobin, a drop in the platelet count, or sometimes the WBC count, which can be very high or very low. both of them are problems. So when somebody sees that kind of a problem, then I think they should then get referred to a hematologist. Initially, they can go and see a physician for these kind of problems. And once they see some problem in the blood counts, they should certainly get that addressed.
Okay. So, sir has given a clear picture on what symptoms we have to look for. And coming to the treatment options, do treatment options differ in children and adults and elderly, sir? How do we go about it?
Yeah. So, a lot of the cancerous diseases, chemotherapy is usually the upfront treatment. And unlike in the solid tumors where surgery and radiotherapy is commonly used, in the blood cancers, it will be only chemotherapy because it's a disease which is kind of there everywhere. It is there in the blood. So you have to treat it with a medicine which will go into the blood and destroy the cells. So chemotherapy is usually part of the initial treatment of most of the blood cancers. Now, clearly the children tolerate it better, so they usually get very aggressive protocols. In adults, it will be similar treatment plans, but in the elderly, we don't want to give very strong chemotherapy because that itself might become life-threatening and produce trouble. So we tend to tone it down. In today's world, there are a lot of new drugs which are available which we can use in the older people, which are not strong chemotherapy agents. They may be targeted agents or mild chemotherapeutic agents. And nowadays, all that is easily available in our country. And so hence, the older people are treated with these milder treatments, and a lot of them respond very well. Some of them have even a curative intent. Subsequently, they can also get a bone marrow transplant done in some of these diseases and get a cure. So all these options are available for these patients from a treatment perspective. So there are differences between children, adults and the elderly, but with the newer drugs available, we can look at helping even these subset of patients.
Okay. What sort of complications can we expect during treatment, sir?
So because these are aggressive diseases, the chemotherapy is usually very strong, and it is more like carpet bombing where it goes and hits all the bad cells and the good cells, and all the rapidly dividing cells are hit. So typically whenever somebody gets chemotherapy, you would have noticed there will be hair fall, they'll complain a lot of nausea, vomiting, skin changes. So their blood counts also will drop. When the counts drop, they are more prone to infections. And a lot of infections you pick up from within yourself because there are bacteria within your own body itself. In addition, from outside, food, water, air, these are the sources of infection. So that's why we tell people who are getting chemotherapy to be careful about these things and take precautions to prevent these infections from being acquired. So they have to be careful about staying at home, hot boiled water, food which is freshly cooked, not uncooked food, avoid all the raw food. These are all precautions we take to try and prevent them from getting infections when your blood counts are low. When your blood counts recover, then you don't have to be that paranoid. But certainly when the counts are low, these are worrying for us because that infection, if it becomes severe, can become life-threatening, and thereby that becomes a major issue for admission to the hospital. And these are things which can be prevented to a reasonably good extent. So these are cautions we will always advise when somebody is on chemotherapy.
So with the prevailing COVID wave going on, how do we tell these patients to be careful, and in case they get infected with COVID, how can things be managed?
Yeah, so this has become a big worry now in the last 2 years for all cancer patients because of COVID. COVID by itself has its own problem. When it affects a cancer patient, we know that the outcomes are worse. It has higher morbidity and mortality. So definitely we want to be more paranoid in them. They have to be preventive. So masking is an absolute yes all the time, and trying to keep away from crowded places, moving around as much as possible. Whoever around them certainly have to be vaccinated. Some of the cancer patients, for their whatever treatment on, sometimes they may not be able to get the vaccine, and thereby it will be delayed or deferred in them, but eventually they will get it. Transplant patients also can get their vaccinations only after about 6 months from the transplant. So these are all guidelines which are there. But in the ones who can get it, they should take the vaccine, because even if some immunity is built that way, it will help them. But they have to be extra cautious about COVID in today's world. Now we've had the third wave also coming up, and that is spreading very quickly. So all the more reason for them to be extra careful. And because of this, we are actually avoiding patients coming to the hospital as much as possible. We are trying to do teleconsultations and give even advice telephonically to take some of the treatments. We are trying to manage a lot of the treatments at home to prevent them coming to the hospital. Nurses can come home and administer the treatments. And we are trying to avoid very strong chemotherapy where the count drops a lot, to prevent them from getting these potential life-threatening infections. So this is a new thing which COVID has brought on to the treatment of some of these cancers, and it made it a little more difficult for us to handle in these patients.
These patients, as a part of the therapy, obviously they'll be requiring blood transfusions, because this is one more question the patient relatives come up to us, like where do we get blood from? What do we
Right.
advise them about that, sir?
Yeah, so this is another problem which you brought up, which is actually pretty tough on the blood banks in the last 2 years. So because of COVID, the number of people who are coming and doing voluntary donation also has come down. So most of the blood banks are understocked. Or if you've had, vaccination, you have to give a little gap and then go and donate. So we are still encouraging people who are vaccinated to come and donate now, because that's the only way these patients can be helped. Obviously, they cannot get, donors all the time. So we need voluntary donors to actually come forth and donate as much as they can in the voluntary blood banks to kind of circumvent this shortage. Clearly, a lot of patients getting chemotherapy for the blood cancers require platelets, blood products. And this is the need of the hour, and we would also encourage as many people to donate. We are also trying to minimize the requirement to transfuse these blood products by using other medicines to kind of bump up platelet count, blood counts, and white cell counts. And some of them are trying to get it done closer to home and avoid coming to the main hospital for these transfusions, so that again we cut down the risk of COVID for these people.
One more common question they ask us nowadays is, if somebody is vaccinated, how much gap they should maintain if they have to become a donor?
So earlier, they had come out with the guidelines of a month, but then that has now been reduced to 2 weeks now, because clearly there's enough data now that that's good enough. So that's the gap for somebody who's had a vaccination, that after 2 weeks they can come and donate in the blood banks.
Okay. So you brought up something about bone marrow transplant in the therapy of blood cancers. Can you highlight a little bit on that?
Yeah. So there's a lot of hype on the word bone marrow transplant. So clearly, blood cancer is a disease, where the blood which is generated from the bone marrow is diseased. So the problem is within the bone marrow, and that's where all our blood is produced. So with chemotherapy, we know we get reasonably good cure rates, better in children, but in the adults, the cure rates are not that high. And if they relapse or if they have bad disease in the beginning, then we don't stop with only chemotherapy. We go to something called bone marrow transplant. There, what essentially we are doing is we are destroying that person's bone marrow by giving strong chemotherapy and putting somebody else's stem cells, which are collected from the periphery, and into that person, so that they will go and populate the bone marrow and produce the new blood. So effectively, we are completely changing the blood, and that's a good way to change, or cure a disease, because the cure rates are much higher in that. So in the bargain, a lot of patients will come and ask, so will you change our blood groups also? Yes, that also happens. So the blood group also changes. So we are actually getting new blood generated in this person, which is from the donor. Now, donors earlier used to be brothers, sisters who were fully matched, but in today's world where there are only 1 or 2 siblings, people have moved away, and now we also do something called haplotransplants, where we use half-matched donors. So usually all of us will have a half match from either the parents or your children, or sometimes even the sibling. So that has helped us a lot in procuring a donor. And clearly people are getting better at doing those transplants. There was this initial learning curve, which people have now kind of crossed. There's enough data both from the Western countries and from our own country. And this is the new kind of treatment which is available for some of the blood cancers where we need a bone marrow transplant.
Who can be a bone marrow donor, sir? And this is one more thing. Whenever we bring up the topic of bone marrow transplant, the question is, oh, so you take blood from the bone marrow itself, or is there an alternative source? So who can be a donor, and how do you take the stem cells?
So again, a very nice question. And I think the fear always among donors was, when we say bone marrow transplant, we take stem cell, they think that we'll actually go and operate on the bone and take out blood from there. So none of that is done. It is just collected like how blood donation is done from a vein here, from the hand. We just give an injection to increase the WBC count, and that excess white WBCs are actually collected and given to the patient. So the donor doesn't lose anything. Like in a kidney transplant where you're taking out a kidney, here we're just collecting excess cells from the blood. So no depletion to the donor, no harm to the donor. It's only getting 4 days of injection, and on the 5th day we collect those cells and give it to the patient. Now, when we're doing sibling transplants, anybody can be a donor there, right? From, elderly people to small children where we've done collections, because it's a matched sibling donor. In the other setting where, it is a half-matched donor, we try to pick people who are slightly older so that you have adequate body weight, so that, when you're collecting the cells, it's not a problem. So it's easier when somebody is about 20 kilos in body weight, where you don't have to do a blood prime on the system when you're collecting the cells. But even less than that, it can be done. So once you've identified somebody as a match, the age really doesn't matter. We do a general health checkup on the donor to make sure that the donor does not have any problem, is fit, and then fit enough to donate. And if that is cleared, then anybody can actually donate stem cells. But if you look at the unrelated donor registries where people are eligible to donate, that is like the same blood donation rules where they use 18 to 50. Some registries have a cutoff of 50. Some people even push it up to 60, but generally between the ages of 18 to 50, you can enroll as an unrelated donor. But within the family, anybody can actually be eligible to donate stem cells.
Will the donor experience any side effects?
So typically when they get the growth factor injection for those 3-4 days, usually there will be some bone pain which they get when they get the injection, and little bit of general myalgia, little bit of feverishness, sometimes headache. Most of the time it's managed with just paracetamol. They take it once or twice a day and then it settles down after the cells are collected. Other than that, there are no other issues.
Do we have active registries in India, and how do we register?
So there are registries in India, and Dartry is one registry which is available, which has got a big number of donors now enrolled. So through the website, you can enroll yourself as a voluntary donor. Just like how you go and donate blood, you can also go and donate stem cells. Usually we allow stem cell donation only once in your lifetime. Rarely there are instances where people have donated more than once, but most of the time it is a single donation.
What sort of complications can we expect post-transplant in patients, and what are they looking at?
So again, post-transplant patients, they are more prone to infection. So our biggest worry is that they're prone to infections at least for the first 6 months to a year. So we are paranoid and want to be very careful in those patients. We again tell them the same things about, staying at home, as much in isolation, avoid contact from outside, careful on food, water. And again, now with the COVID scenario, we're again, very worried about picking up infections from outside. In addition to the bone marrow transplant patients, they have something called graft versus host disease, which is another problem which can happen because the donor cells can also react against the patient. And there are various medications which we use to kind of circumvent that, but that's something which we keep in mind. And there again, when we use immunosuppressive drugs, they again make them more prone to infection. And this is something which we need to be careful about.
And how long they'll be on medications post-transplant?
So most of them will require it for about 6 months to a year, sometimes rarely longer for 2 years. Unlike the kidney transplant, liver transplant patients who need it lifelong, bone marrow transplant patients within about a year or 2 years, most of them can come off the immunosuppression. That's one of the good things in this kind of transplant because we're changing the immune system. And again, to kind of re-educate that immune system, we do another round of vaccination for all of them after about 6 months to a year. And similarly, the COVID vaccination also comes in there in that protocol. So they get another round of vaccination after they've had a bone marrow transplant.
So it's just like rebooting the immune system.
Yes, it's like another rebirth of another immune system. So that's what we kind of achieve by doing this.
So that was very exclusive on bone marrow transplant. So what is immunotherapy in blood cancers?
Right. So that's another nice question which has come up. A lot of people in today's world are talking about immunotherapy because people have moved away from this traditional chemotherapy to newer ways to destroy the cancerous cells. So you can use antibodies, which are usually monoclonal antibodies against specific antigens which is expressed on the cancer cell. So instead of carpet bombing, it's now become sniper shooting. So you find a target and you shoot it with that antibody which goes and kills that tumor cell. So this is the newest thing which is available. A lot of these antibodies are available now. Earlier it was only available in the US, but it also can be available in our country now. And we are using this for some of our patients either who initially did not respond to chemotherapy or sometimes even in combination with chemotherapy, and thereby our results are improving. Some of them get that either before transplant to kind of get them into a scenario where they don't have any disease before they go for transplant. And this is clearly available in our country and useful. Another therapy which everybody is talking about now is called CAR T-cell therapy, where we are able to take the T cells from the patient, re-educate it using a viral vector and get them to express some antigens which can go and then kill the tumor cells, And this is called the chimeric antigen receptor. And this targets that cancerous cells and kills that. And this is now, initially it was done in acute lymphatic leukemia. Now it's being done in a lot of other diseases like lymphoma, myeloma. People are even talking about it in acute myeloid leukemias. So this is the new kid on the block. And this was also currently only being available in the US and in Europe and in China. But thankfully now, even in our country, it has started. Tata has already initiated something in that front. Some of the work is also happening here at the Mazumdar Cancer Center at Immunil. And in a few months, I think we should be able to start trials on our own Indian patients. And once we get those results, it should be easily available to the general public to actually undertake this therapy, which has very good response rates.
So is the response better than a bone marrow transplant, sir?
So this has initially, this treatment was used in patients who had relapsed after bone marrow transplant, who had nothing else to offer, and they started getting cure in those subset of patients. So people are now looking at it as an option to transplant, or sometimes even after transplant, and now it may come even earlier as a bridge to potentially transplant later on if required. So it's getting placed all over now. So with more and more data being available, we will see whether this gets offered either upfront or maybe just after chemotherapy itself. And in some patients, they may not even need a transplant, or maybe an option after transplant. So multiple uses of this kind of treatment.
We have discussed the various treatment options for various types of blood cancers in detail, and these treatment options are very much available in our country in various centers of the country and also at our hospital here at Majumdar Shah Medical Center. So the main thing is the patient should be diagnosed early and referred early so that he can avail treatment at the earliest, so that we can achieve the theme of this World Cancer Day, closing the care gap. Thank you, sir, for this exclusive overview on the various blood cancers, and you educated the masses about the treatment options and also the donors, how they can register. That was very comprehensive. Thank you so much, sir.
Thank you, Akshara, for all the questions. I hope we covered most of the queries.
Sure. Thank you.
Thank you.